Welcome to the SnapScale Show, hosted by Mike Yablonowitz and Nathan Bush. In every episode, we explore the real challenges and breakthroughs happening in modern healthcare operations, from navigating compliance to virtual staffing and emerging technology. You will hear real stories from clinics, learn from healthcare leaders, and uncover practical strategies that help you run a smoother, more efficient practice, without losing focus on what matters most: patient care. SnapScale exists to take the pressure off your front office and administration work, so you can get back to doing what you love. Be sure to subscribe to our YouTube channel to get the latest episodes, and visit snapscale.com to learn more. Let's simplify healthcare operations together. This is the SnapScale Show.
Welcome to today's private training. I'm excited that you guys are here. I'm going to share with you some behind the scenes look at how one orthodontic clinic went from overwhelmed and stressed out to 2 clinics in a very short time behind the very intelligent work of CEO Christina McGinnis. So if you're looking for that webinar on how to scale to 2 clinics, you are in the right place. By the end of today's session, we're going to cover a couple of different things. Number one, you're going to be able to walk away with what to do about non-clinical staff. How do you utilize non-clinical staff? What are effective ways to staff non-clinical staff? In addition to that, I'm going to help you with some understanding of routine hiring, how to not lose control without sacrificing patient quality, because that's the other thing you don't want to do if you're staffing with virtual assistants. You don't want to lose control of your practice. You don't want to lose the ability to have good patient care. And so you're going to hear directly from CEO of Redemption Orthodontixs, Christina McGinnis, and she's going to share with you how she used this exact system to scale to 2 locations and scale quickly. Her results are so effective that we had to turn what she's been going through into a private event just for you, the clinician, to learn all about how she did it. And we're thankful that she took time to be able to walk through her strategy and her approach to do so. So let's unpack how you can scale and you can grow without putting in a extra chaos into your life. I want to make this peaceful. I want to take you from operating from chaos, like you see on the screen right now, into complete clarity with what to do with your non-clinical staff and what works actually. So here's the thing though, these types of webinars, they require some attention. And we can easily get distracted by our cell phones. I know that we've got other things going on, phone calls come in, but if you can take 60 minutes, guys, and just focus in on trying to solve this one problem of staffing inside your organization, I promise you it'll be worth it. Not just from what I have to share with you, but from what CEO Christina McGinnis has to share with you and how she operates her clinics with virtual staff. There's a couple of different things. She uses internal staff and virtual staff, and she's going to share that with you. First things first, though, if you've ever been on a SnapScale webinar before, put Y in the comments for us and let us know whether you're watching online or you're watching through the LinkedIn or even on replay right now. If you'll put Y in the webinar comments, that'll let us know that you've been on a previous webinar before. If not, will you put in the comments for us? That will really help us out. It'll help us know if you've been attending and learning along the way, or if we can go back and share some additional information that maybe we've covered before, but you didn't get the opportunity to catch it. So why, if you've attended a webinar before, in the chat, in if you've never attended before. The second question that I want to ask you guys while you're watching online today is, if you came for scaling your practice to learn how to scale, will you press 1 in the comments for me? It's just a simple 1. That's it. Just put on the keyboard, push 1. That'll help me out. If you came to learn what it takes to staff a virtual assistant, will you press 2? I'm trying to get clarity and make sure that our messaging is working and that you're in the right place that you're trying to learn. Because here's the thing, we're going to cover how to scale today, and we're going to cover how to utilize virtual assistants, how you can set up tasks for them to do, what specific tasks they can do and cover in your practice. And so I would really appreciate the opportunity if you would push 1 or 2, 1 for scale, 2 for virtual assistants. All right, guys. with that said, I'm going to dive into some information that's going to help you. And again, I told you there's 2 promises. So the 2 promises are, number one, you came to learn in this webinar and you want to see what tasks a virtual assistant can do, how to offload those tasks, and how to scale. Okay, we're going to do that. We're going to show you how to do this with patients, improving patient care. We're going to show you how to do this to improve schedule flow, to gain clinical patient precision. We're going to teach you all of that on this webinar. Also, at the end of this webinar, I can promise you this: if you want to take the next steps and meet with somebody from our organization, I'll share with you exactly how to do that as well. And so I just wanted to make sure that you guys had a clear understanding of what we're doing on this webinar. All right. CEO of Redemption Orthodontixs, Christina McGinnis. Let me tell you a little bit about Christina before I bring her into the show. Christina is a highly accomplished leader with over 23 years of experience in the dental field and a proven track record for managing both businesses and operational aspects of healthcare organizations. As the CEO of Redemption Orthodontics, she combines her deep dental expertise with a strong background in business management, focusing on improving patient care, operational efficiency, and community health outcomes. Christina holds a master's in public health from Florida State University, which has cemented her vast experience in the dental and healthcare sector. Her career spans a wide range of leadership roles, including chief operations at the Florida Department of Health, where she successfully led state and public initiatives, including a statewide oral health program. Her work in this capacity helped shape policy and programs that enhanced the oral health access and outcomes throughout Florida. In addition to her operational expertise, Christina's knowledge of Medicaid, and managed care is extensive. She has served on various Medicaid managed care advisory boards, providing valuable insights on improving care delivery and ensuring that Medicaid programs meet the needs of the underserved population. Her deep understanding of federal and state Medicare regulatory affairs allows her to navigate the complex intersection of healthcare policy and clinical care with ease. With over 15 years of public speaking experience, Christina is a respected voice in the dental and public health communities, regularly addressing conferences and forums on topics related to healthcare policy, business management, and the dental field. Her ability to communicate complex ideas effectively has made her a sought-after speaker and educator. Christina's 23 years of dental experience spanning clinical practices, operational leadership, and policy development, she has shaped her unique perspective on the healthcare landscape. She has a long-standing commitment to improving oral health, healthcare delivery systems, and making significant impact in both the industry and communities she serves. Through her leadership at Redemption Orthodontics, Christina continues to drive excellence in both patient care and business management. I'd like to welcome to the webinar CEO of Redemption Orthodontics, Christina McGinnis. Hi, Christina. How are you?
Hi, I'm well. When you say it like that, my goodness. Who is that? No, I'm just kidding.
I know, right? I was reading through your bio, honestly, whenever you first sent it over to me. And I had no idea the extensive experience that you had, not just in orthodontics, that's incredible, but just dental in general, how much you've served the underserved population through Medicaid, all the way back to your public health degree that you got from Florida State University. You've spoken on stages. What an incredible background. Why don't you share a little bit for everybody, kind of your journey into orthodontics and how you got it to where you are right now?
You know, it's so funny when people wake up, sometimes you're like, how did I get here? How did this happen? How is this kind of like living the dream possible, right? And so from a very young age, I always knew, I was like, I'm going to be a dentist. When I grew up, I'm going to be a dentist. My whole family's in the dental field, whether that's dentist, dental hygienist, owning dental labs, training dental software, whatever it is, that's all kind of been in my family. It's what I saw at a young age growing up. And so I was like, I'm going to be a dentist. So I go to Florida State and I'm like, okay. And then you start to realize that maybe you don't think that way, right? Maybe you think in solving other problems and issues that are maybe a little bit using a different side of your brain, not necessarily the math and the numbers and the science and things like that. And so kind of going through my coursework, I got connected with the Leon County Dental Clinic. And it is, it serves the underserved, it's a Medicaid clinic. And that's where I first kind of was introduced to public health and how it actually, literally, physically, in any way you kind of want to assume it to be, is changing lives, right? And so from there, found public health, ended up getting my master's degree in public health, and kind of in every situation or every promotion that I found myself in, I was fortunate to find a way to not only kind of still focus in dental, it's just what I'm passionate about, right? But also be able to kind of merge all of those areas and still bring it back to oral health in some way, shape, or form. So if it was running the statewide oral health program at the Department of Health, okay, great, physically, right? You're running statewide oral health programs. You're mobilizing people in various counties where they don't have those kinds of services, right? And so from there, going to health policy and just kind of every role and promotion from there, finding a way to bring it back to dental, finding a way to bring it back to oral health. And every single role, every single aspect of those roles has prepared me for my role now, which is crazy to think of, right? You're like, okay, and you're a young kid out of college, you're like, all right, I'm going to do this. All right, here, I'm going to do this. This sounds like a cool thing. I'm going to go train in, North Carolina to get a coding certification. Why in the world would I need a coding certification? I'm sure we'll get to that later. But, when you just kind of take a step back and you're like, this is much bigger than anything I could have planned. This is definitely God's work, because how in the world could every single thing have prepared me for where I am now? And so it did. And so that's kind of where we are today. And it kind of helps that part of this is getting to work with my family as well, which I'm sure we'll get into later. But how cool is that? Every single prepared me for now. And so, you think about preparation season, you think of, okay, now is the time that I'm going to get ready for my next clinic. Now is the time I'm going to get ready for my next associate. It is. And at the same time, every single of your experiences truly shaped you. And that might sound cliche, it might sound silly, but it's true. And it's kind of where we are. It's where I am today.
Yeah. Now you lead staff in your clinics. You have 2 of them now. And remind me again, you started your first clinic, your first orthodontic clinic in what year?
So we opened Redemption Orthodontics in March of 2022. And so it's a combination. So we have 2 orthodontists. They are married, Dr. Michael and Dr. Taylor. They are amazing. And Dr. Michael happens to be my brother. So yes, there's a little bit of nepotism there. But, if it wasn't successful, I think I would also get the other end of the stick on that. And so March of 2022 kind of opened our doors. It was kind of an interesting story how things happened. I have been in Tallahassee since I graduated high school, came to college, stayed here, met my husband here, all of those things. And Dr. Michael and Dr. Taylor had moved to Tallahassee to originally partner with a different orthodontist. And at the last minute, he had decided that maybe it wasn't a good idea to partner with a married couple. And so it was from January to March that it was like, okay, well, I guess we're going to open up Redemption Orthodontics. And, I had very much so a backseat at that time, just kind of hearing some of the things that Dr. Michael and Dr. Taylor were doing. I was like, wait, what are you doing? Are you really opening this up? And so they did. And very quickly outgrew a short-term rental space that we were kind of co-located with in Tallahassee. Moved to, thank goodness, another orthodontist just happened to be retiring and had already a clinic set up that was vacant. That was just amazing that we could kind of blossom and at least rent while we were renovating a different space. And so you know how renovations go, construction goes, took quite a bit of time, but we're very fortunate to have all of those experiences to be able to very quickly outgrow 2 different rental spaces until we could outfit our first location in Tallahassee. And so we finally were able to finish that construction in March of 2024, and now have just completed a new build in Tallahassee as well on a different side of town, and officially opened on February 7th of this year. And so it's been a whirlwind. It's been so exciting. And, at the same time, it's like, okay, how do you make sure that some of your core processes are handled consistently while bringing on new team members that don't have experience in dental? And how do you keep your operations going and successful at the same time, right? And so that's what kind of, we were like, we need a different solution, right? We need something that can work well in the background while we're handling patient care. And you're like, well, what can that possibly be? And so we heard a little bit about virtual assistants. And we were like, well, I don't really know. It kind of sounds weird. It's like, how do you even, like, who do you talk to? Who do you find? And, just Googled it really. And we're like, okay, let's see who is kind of in this space and who shows up as some of the, kind of more established organizations. We talked to a lot of virtual assistant organizations. And one of, I think, the reasons that we decided to go with SnapScale, previously BBC Global, was because they care. And so our mission is to love and serve just as Jesus did. We're a Christian-based organization. And for us, making sure that it didn't feel icky, I don't really know a better way to say that, in working with somebody that might be abroad, it was very important to us that we found a company that cared for others as well as SnapScale does. And so, the ability for the team members to have vacations and have healthcare and have, a stable source of income that might be higher than some other opportunities that they're able to have over in their country. It was really important to us. And that was really the deciding factor. And so us being able to kind of find that avenue for a virtual assistant to help scale some of our more repetitive things was really what we needed while we were focusing on that in-person connection, in-person patient care.
Yeah, what you guys just heard Christina McGinnis, CEO of Redemption Orthodontixs, share is the case study. I put together a case study for you based upon a previous conversation we had, and you can get that from just setting up an opportunity to speak with somebody at SnapScale. We'd be happy to send this over to you. You can email us, text us, whatever way you need to get in communication with us. Whether you're online, you can put in the comments right now, case study. We'll make sure that you get a copy of this case study. The opportunity is there for you to be able to see step by step exactly what Christina went through, her selection process, and ultimately her decision in order to move forward in the case study that we provided for you guys. And it's all there. And I'm happy to share it all with you, and we're happy to deep dive into that. But Christina is CEO of a fast-growing orthodontist organization. Focus is something that's probably extremely important. And there's two types of focus, right? There's big picture focus that a CEO has to have, and you got to be able to be focused on your overall mission, what you're trying to accomplish. And then when you're talking about virtual assistants, as a CEO, you also have to be able to focus all the way down. Your organization, at least, has to be able to focus all the way down to individual tasks that have to be able to get done in the day, in the moment. And our ability to focus ultimately determines the impact that we're able to bring to a community. What are some tools and ideas that you had when you first started Redemption Orthodontics to be able to focus your big picture mission and your tasks for your organization?
Sure. I think that's probably one of the biggest struggles of a true startup. And, I think it's kind of the trend right now in orthodontics is to kind of take back your profession and for people to really, truly start their own organization from the ground up. And when you do that, there is nothing. Right. There's nothing, no walking into the door with patients, waiting to come see you that have been seeing a previous orthodontist for decades. There is no process for anything, let alone the individual steps to get to certain goals and metrics. And so when you're really trying to kind of be like, okay, well, I have no idea where I'm going. I'm in the dark. You're like, okay, for us, being completely and like crucially to a fault almost organized has really just been our driving force. Like, yes, can we do something? Yeah, we can do things. Can we do it really well is more of the question. And if we can't, then we're going to wait until we can do those kinds of things. So when it comes to kind of helping us to be prepared to take on a virtual assistant, right, there's quite a bit of work to get to that point. everything in our goal to be so precise and so organized and so crisp carried over and kind of made that virtual assistant implementation a lot smoother than it would be, probably for another clinic. And so coming from the ground up with nothing, having to formulate something and continuously process and improve, of course, you can't just let it go by the wayside. Something's always going to be able to get 1% better every day. Kind of really made that pathway for us to have virtual assistants and implement those. So being able to manage the individual tasks comes down to our ridiculous obsession, I think, with checklists. And in order to have those checklists mapping out every single thing, can I say submit 100 claims today? Sure. But does that actually walk somebody through every single area to make sure that each of those claim submission is done appropriately? Is the coding done right? Bringing in that coding background, right? Is everything so completely accurate that we can say, yes, we are doing the best of our ability here. And that is how then we're relaying that information to our team members to be able to then do the same, right? If I can sit down and I can say, okay, this is the way that I am going to submit an insurance claim. This is the way that I'm going to be compliant with regulations. This is the way that I'm going to hold that standard for my team. Okay, great. Now I have everything mapped out to be able to mobilize those team members.
Yeah. So just so the orthodontists that are watching, or the clinic owners that are watching in orthodontist or dentistry, can you share a little bit about just give us an overview of your clinic's primary service offerings? Because I know we all know braces, but what are the other services that you're offering inside of your clinic that will help some of them understand the complexity of that?
Sure. So for us, we're an orthodontic office, and so we offer braces and Invisalign. We're a Diamond Plus Invisalign provider, and so that means you're kind of at the top 1% of your game, nation, world, whatever you want to say when it comes to Invisalign. But really having such a split of and share of Invisalign to bracket and wire patients kind of means you need to manage two separate clinics almost. Generally, we see people that are super successful in brackets and wires and braces. Sometimes we just see people that are totally a digital practice or totally Invisalign. And for us, our population is so different, whether it's age, SES level, whatever their smile outcome journeys are. We see a lot of complex cases where sometimes that's one modality is the only way we can do certain things. And so for us, kind of being able to just focus in on those two services kind of means we have two separate pathways, two separate clinics almost, if you want to say combined in one. And I think that's the most difficult thing. Well, not the most, but one of them anyway for orthodontic practices is like, okay, if I invest my time, effort, and energy into clinical services and I want to make something as great as I possibly can, I want to make sure that the patient experience is completely, handled from start to finish. They are comfortable. They are welcomed. They are, moving through their treatment and progressing, as quickly and safely as they can. They don't want to be in brackets, wires or Invisalign forever, right? And so managing the services and really honing in and getting very specific into what you're doing within each of those services. I mean, it's ultimately the patient experience, right? And so to answer your question, yes, we do braces, we do Invisalign, but also, sometimes we might do some whitening and things like that. But really, our goal is to deliver smiles in our town and get our patients connected back to their dental homes. A lot of times people are coming to us, they want braces. They're like, I want my Hollywood smile. And we're like, oh my goodness, you need to find a dentist before you come talk to us. And so it's really been really, really awesome to not only be able to help those that are at the point where we're able to help them, but also help people that maybe wouldn't have understood or didn't have the health literacy and be able to know where to go first to actually help their oral health and their smile. So, that's been kind of a fun thing too, but really focusing in on the Invisalign and the braces.
Yeah, that's fantastic. So Christina, before partnering with SnapScale, what were some of the main challenges again that you guys were facing as you were scaling and growing? Because you went from one clinic to two clinic. And so there were administrative tasks that clearly you guys could use additional help with. What was the chaos like before? What was it that caused you to get online, to start doing the research and put forth effort to solve this problem?
Sure. What we were running into was not only were we seeing turnover within our team, some of our team members are fairly young, some of them are in school, and a lot of them graduate and move on to different cities and things like that. And so for us, it was turnover and having very consistent delivery of our certain steps, processes, and flows that we needed to make sure that they were being consistent and consistently done. And as we started to kind of look into what those things were, we found kind of a breaking point of what could be done behind the scenes and what needed to be kind of in front of somebody. And so that split, we were like, okay, if we have, X team members that are here in person, how am I going to make sure that all of the behind the scenes things are happening at the same time as somebody sitting right in front of somebody, right? Like if I am, patient, if I'm interacting with patients all day, I can't possibly do all of the very other important things that still need to happen behind the scenes. And so for us, kind of seeing that break between, okay, this is patient focused and this is behind the scenes. And even within the administrative world, everybody's like, oh, it's admin, it's non-clinical. Well, okay, but there are still some things that you're going to need to be interacting with the patient on, whether it's at the front desk, it's check-in, it's actually being the person that's helping them navigate to the physical room for their consultation, right? It's the treatment coordinators. And so all of the things that are kind of in that administrative world where everybody thinks non-clinical is just, non-patient. Well, that's not the case, right? But there is a break between what will be in front of a patient and then what can be behind the scenes and is repetitive. And for us, those repetitive things that were behind the scenes were starting to not be at the same kind of pristine level that we needed them to be to make sure we were handling and taking care of our patients. Our AR percentages started to get way out of whack. There was things that weren't happening because there was people that needed to be in front of other people physically. They couldn't be going back behind the scenes, spending 30 minutes working with an insurance company for one claim and one patient claim issue, right? And so the breaking point for us was seeing some of our numbers and we're like, what in the world is happening? And then breaking it down, spending time in each of our areas and seeing, okay, well, our team members need to be actually in front of people. And then I have things that don't need to be in front of people that I need to be able to have somebody handle that are very repetitive, but very important in order to make sure your practice is still successful.
Yeah, I mean, this is totally something that I come out of the hearing world. Okay, so I used to manage and help hearing clinics fill their offices with patients. I would train the staff on how to treat hearing loss and deliver the treatment plans. I worked with the call centers to be able to reach out to the community of people who were interested in getting their hearing tested. And so I worked with all different levels, clinical and non-clinical levels in the hearing industry. And what I have come to find out is that if your front office staff, the people that are in your offices, aren't able to meet and connect with the patients, if they have to stop to process something or whatever, you lose the personal relationship and the personal touch. I love the virtual assistant industry because we utilize SnapScale in the hearing industry in order to be able to scale and grow our clinics and practices. And I love what you're talking about because you're talking about the human element and not taking the human element out of the relationship with the patient. And it doesn't matter whether we're talking AI, we're talking a virtual assistant, we're talking a virtual kiosk that goes in your office. Look, we have clients, Christina, right now at SnapScale that are 100% virtual front desk. They have nobody in the office, but they have enough virtual staff that it makes sense for the virtual staff to have the relationship with the patient in the way that they've structured their offices. The same is true with what you're talking about. You have people in your offices that maintain the patient relationship, which is great. And you've found certain things that you could checklist itemize for virtual assistants to be able to do. In fact, we're going to talk a little bit about your practice in just one second, but just for those that are watching live and watching this on replay, I want to give you some overall, just in the what we call the leaky orthodontics funnel. This is where most orthodontic practices are losing time, trust, revenue with their patient. And I just want you to think about these things for a second. And I'll let Christina talk about her practice and which one of these she selected and how it has helped her. But this is a SnapScale's overall view that there's a variety of different stages where we're leaking trust, we're leaking revenue, or we're leaking time. And it could be in new patient inquiries. Maybe you've missed calls. You have missed calls that need to be responded to, or your people are on hold too long. And so you have lost conversations that aren't happening. Or maybe you have consultation bookings, but there's delayed follow-up. And so the patients ghost your practice and you never hear from them again. How about this one? Insurance pre-checks. These are time-consuming activities. And if you don't have consistency here, you can have slower treatment starts. You can have a variety of different interruptions in your business. And so insurance pre-checks, insurance verifications are extremely critical, but they interrupt your staff. They interrupt you from being able to deliver your treatment in a timely fashion and work with patients. How about treatment follow-up plans? The breakdown here is that the staff gets overwhelmed. And so you have drop-offs and delayed starts or front desk messaging. So today, a lot of people are utilizing HIPAA compliant direct messaging or text messaging back and forth with their patients. And so somebody has to manage that. Somebody has to actually physically respond to people who are inquiring about different aspects of their treatment and care. And so you have dissatisfaction that comes out when people are unresponsive to those messaging systems, or no-shows. Let's say you have people not showing up or the reminder calls aren't being made. Well, now you have missed reminders, and what ends up happening is you have 0 people in your chair. That's $0. And the last one here, in the last stage, is the doctor charting. This is done typically after hours. It leads to burnout by your doctors. And so you need somebody to put the documents, the information, the notes into the software system. Look, these are all different stages that virtual assistants can literally help and change your life, improve trust with patients, improve ROI for you. Christina, how does your practice utilize the virtual assistants? What types of tasks do you have them doing?
Sure. So for us, we have found the most success if our virtual assistants can be kind of working in tandem and feel as though they are part of the team, because they are, right? And so we have a lot of different communication channels that we use. And really we have kind of a group messaging and group, kind of style posting things for our concierge team. So for our front desk reception team. And so the majority of things started in this area where we had repetitive tasks that we needed help with to make sure that they were done. Yes, can I make sure things are automated? Yes, can I use AI? Of course. When you're in some learning phases, one, you might not be at the point to even have something organized enough to be able to do something like that. But at the end of the day, you also need to make sure that you're taking care of patients in the way that your clinic has decided that it's best, right? And so for us, we use the virtual assistants in that concierge world. Initially, a lot of just kind of, templated follow-up with patients, really for trying to get them back into the clinic when we hadn't seen them in some time. It's always a wild idea to me that people pay for a service and then they don't come back and continue that service. Like, it's such a wild idea. You're like, what are you talking about? Like, you're paying for this Invisalign and these braces actively, or you've already paid in full, and you're like, how come you're not coming back? Like, wait a minute. So there are times people have crazy hectic lives, right? Everybody is super busy. Everybody wants things in seconds and things like that, and we forget about some of the other things we have to handle. And so for us, using a virtual assistant, just very initially, very small kind of scale, using templates to try to follow up to get people back in for their continued treatment and care, it was really kind of the first kind of initial things we were doing. Then from there, we branched off and we're like, okay, we know that so much time is being taken up from our in-office team members on the phone. And the thing that I, try to avoid as much as possible is somebody coming into the clinic and being like, yeah, 1 second, they're there in front of you, right? It's like, we're not even respecting their time or, able to help them. yeah, 1 second, and you're trying to get information for an insurance verification on the phone. And so just didn't sit right with me. And just, it takes a lot of time. And so with our team members needing to focus on that in-person patient care, we're like, okay, well then let's branch off from some of those templated text messages to additional things, right? So the insurance verification. And so, we have a checklist for that. Of course, we have a checklist for everything, right? But we have a checklist of exactly what to ask, how we want it asked, what the information is we need to collect from different insurance plans that we're out of network with, and what those things look like. And so then kind of branched into there. And then from there, had them doing some different of our lead gen system and new patient follow-up, having them schedule patients, and then just continue to branch from there on what we were like, okay, well, now we realize that we need to add this in. Now we need to realize that we need to add another virtual assistant in. And at one point, we did have 3 virtual assistants running simultaneously just in the concierge team, where we had those tasks. That's 40 hours a week, right? And so we had 3 times 40. We had all of that support in addition to the in-person team members to be able to continue to scale and bring in new patients, help our existing patients, and then make sure that we were maximizing all of their insurance benefits that they may have.
Love that. We teach at SnapScale here a process called the Med2 method. We had a Dr. Med2, he was an oculofacial plastic surgeon, and he designed this method for onboarding virtual assistants for us after he did it. And so we teach team and staff members on how to implement virtual assistants in organizations in our own company and then in the companies we work with. And one of the things we talk about is, remember the movie Zorro?
Yeah.
Zorro talked about the Zorro circles, right? And you learn the first circle and then you move out to the second circle and the third circle. Well, we teach the same thing as far as task delegation to virtual assistants. It's a little bit different than working with stateside employees. Stateside employees, when you do training with stateside employees, it is very normal and natural to teach them the entire overview of the company, the entire overview of the job that they're going to be doing, and then show them each different part of the job, train them on the different systems of the job, and then you turn over to them and let them get started. And then they work, and then you fill in the gaps through what they don't know with backup support and coaching. When you're hiring a virtual assistant, we recommend doing it a little bit differently, because a virtual assistant is in a different culture. Practices in their culture might do things, or businesses in their culture might do things a different way. They might handle patients differently. They might use software differently for where they put information or how they store it. And so what we recommend is starting with one task, one process, one goal, and show them how to do that one thing. Once they've mastered it and you can document it and track it and you feel good about the work they're doing, then teach them the second task that you want them to do. And you don't have to give the overview of the company. You don't have to give the broad generalization about what they're trying to do. You're not teaching them about the mission and the people and the processes that you're serving. That's stateside training that we've learned to do and how important it is to get buy-in. Your team members, when you hire a SnapScale team member, they are bought into your organization because they're bought into SnapScale already. We help people establish culture in the Philippines or in India, depending on where your team member's house. We help establish that culture at SnapScale. And so what you're looking to do is train them on the individual task that needs to be done. I've asked this question because this will give all the viewers, Christina, a little bit better understanding of what I'm talking about. How was your initial experience with the healthcare virtual assistants? And walk us through the onboarding process that you went through, how meticulous it was, and how it aligned with your needs as a business.
Sure. So initially, the only way that we had many conversations with SnapScale, and one of the kind of vetting processes from their side to us as well, which you're like, why is a different company going to vet me? Like, I'm going to go hire them, like, what are you talking about? Is because, you guys did need to make sure that we were in a place organizationally to be able to have a successful virtual assistant. And so I remember many of the conversations in the beginning, like, okay, walk me through, how do you do this? Is it written down? Do you have training manuals? Does the training manual tell somebody how to get from step A to step Z? Is everything formulated in a electronic way, right? Okay, you might have paper, whatever. Is something set up where the virtual assistant can access it remotely and still be able to be successful, not printing out a bunch of pieces of paper to write something down and move through it? Little things like that to make sure that we were prepared. We're like, well, we hadn't really thought of that. So at the time, we had a different concierge manager, and she was really helpful in making sure that all of our processes were documented. And of course, you document things, but then you process and prove. You don't go back to document the things, right? You don't have that additional checklist item to make sure that, step 1A is also added in, right? And so it was just making sure that things, we thought we were in a good place, and we're like, oh, maybe we need to go back and revisit some things. And we did, and we're glad that we did, because it was still challenging in and of itself, where you're like, okay, how hard can it be? Like, I'm just going to have somebody work for me remotely. Okay, like, I get that, right? But it's not just remotely. It's remotely in a different time zone, in a different country. And so, having those discussions on the front end, I think, did help a lot. But it wasn't as hard as implementing, training an stateside, as you termed it, team member. But at first, we didn't quite know what we were doing. And although you have your processes document, you have your steps document, you're like, okay, of course I know how to verify an insurance. When you try to translate that to an electronic way where maybe you just hadn't thought of that before, you're like, well, how is somebody gonna do that? It just took a little bit of navigation and preparation. And I'm not talking, like months or something like that. I think it was like 2 weeks that we were like, okay, let's get things prepared, and let's make sure that we're in a place to be able to have these replicatable processes that we know work in office, have done by somebody that is in a different time zone, in a different country, and, just totally remote, which, I come with my background, I managed remote team members. That's not an issue, but things were set up already for success of remote team members. And generally, I would just say, from the orthodontic clinics that I have, visited across the country, trying to see lessons learned and things like that, the majority of the things, there is no remote work. It's taking care of the patient in the office. And so, it's not a crazy foreign, excuse my terminology, concept to be able to do remote things. But in an orthodontic world, it's kind of crazy. You're like, well, what can you do remote if you're not, helping a patient? Well, there's a lot, actually, right? And so initially was a little bit of kind of a bumpy road, but I think most implementations are, right? Until you kind of understand what's going to work well, how is it best to communicate, what do those kind of check-ins look like, how do you ensure that the virtual assistant, at least from our perspective, was, always on task and didn't get bored or didn't have, all this free time for something else to do. Because while we were able to know what our in-office team members' workload looked like, when we removed that patient being in front of somebody, we didn't know the exact time that it was going to free up. Right. And so there was a lot of touch bases. There was a lot of recorded trainings. There was a lot of things that initially we did to kind of onboard those team members. And did it take it forever? No, it took a couple of weeks. But once we did, then we were able to make sure that we could always then replicate that in the future as we needed to for additional or different virtual assistants.
Yeah. I mean, what you're speaking to is what I call the red flags in virtual assistant world. If you hear people talking about how easy it is to hire a virtual assistant and that they're just ready to go, they're already trained, they already know your systems, and they can jump right in and start working for you, that is a red flag. If you hear that you can do this on your own and you can just try to find a virtual assistant organization that's out there that will put you with somebody that's for less cost than what you would pay for somebody stateside, and you're just going to have this magical relationship that you're such a good trainer and you can teach them remotely, that's a red flag. These are not ways to do this service properly. And so the reason that when I was in the hearing industry, I went with SnapScale, the reason that Christina went with SnapScale is because you heard that while there is a cost savings, there is a major benefit financially from being able to utilize overseas staff members to run processes and procedures in your organization. There is a strategic management approach in onboarding that has to happen, and it has to be, for lack of better terminology, massaged so that you get the outcomes that you're looking for and the benefit from what you're trying to do. And so with that said, I'd like to ask you about some of the benefits that come from the virtual assistant. And, real quickly, have you ever had a situation where the virtual assistant from SnapScale impacted your relationship with the patient? And can you share any specific experiences about that, Christina? What impact with a specific patient?
Sure. I think some of the things that stick out most for us is being able to really provide that individual boutique kind of care when you have a larger scale organization. And so, in orthodontics, we kind of see that there's going to be that small boutique practice that has one orthodontist and, they have, hour and a half, 2-hour-long appointments. They have a very small patient base. They charge very high fees. And so for us, taking the benefits of a boutique practice, of that individual patient connection, has always been what we're trying to do, while being able to still see the volume of patients and handle 2 orthodontics that we have here. And so for us, it's just been kind of interesting where some of our personal touches actually end up translating and changing people's outcomes. And so you might think it's silly, but so one of our virtual assistants tasks that we have them do is to reach out to them and tell them happy birthday. We run our happy birthday report. We say, hey, we add a personal note from something that's been in their chart. We hope you have the best birthday. May God continue to bless you. And, we hope Johnny's surgery went well, right? And so we have these kinds of things where we're either touching base with our patients to give that individualized care, of course, but also the other fun things, the birthdays, the anniversaries, the celebrations, and milestones that we want to make sure that we're communicating. And so some of our virtual assistants, we have them doing those kind of happy birthday text messages. And some people have told us it's very sad, but some people have told us that that's the only happy birthday that they got. And it might seem silly, but it just made somebody's life a little bit better that day. And so if we can do that, if we can have our virtual assistants showing that those positive things, making those connections with our patients, they might be remote, but that doesn't mean they don't care, right? And so even those little personalized touches have just made a difference where we're able to deliver that kind of boutique care that you might think of in the orthodontic world, while still seeing a larger volume of patients and not charging ridiculous fees, and being competitive in our local market while still being able to deliver those touches like that. I think that's some of the cooler things that we've seen.
Such great point. Now, I promised everybody that we would answer this question for them. This was the big claim for the entire webinar, this private online event that we're doing right now for orthodontic clinics, doctors, and dentists, and a variety of other clinical organizations. But what is the orthodontic growth formula? You did this so fast. I want to dive now into how you scaled to 2 clinics and what you did to get some scale without drastically increasing your overhead. How did you do it?
Sure. It's not like a magic formula, right? It's a lot of trial and error. It's a lot of finding the things that work best for you, that are going to continue to increase new patients, increase conversions, of course, and then also continue to, treat people within the diagnosed timeframes. Very easily can orthodontists be super picky. That's what they went to school for, and they can continue an ongoing treatment. And we're like, okay, we can't have that, right? So for us, it wasn't a magic formula, like, okay, all of a sudden, let me put the wind's blowing east, I have 2 clinics. Absolutely not. It was, okay, what are we going to do in each single department, each single area, each single task, to make sure that, one, it's stable, but also that it's successful, right? And so for us, when it comes to, okay, well then how did you grow into 2 clinics? It was a lot of trial and error. It was a lot of, okay, what can we maximize some of our other partners for across a variety of things, right? You need everything. You need your marketing to work. You need your, in-office team members to care for people. You need the clinical team to be able to deliver high quality care. You need them to be licensed and certified. And so, across all of the things, it was trying to figure out what worked well for us and finding the opportunities for small successes over time, small things that we could say, okay, I'm going to piecemeal today. I'm going to work through how in the world am I going to have 2 locations and 2 sets of insurance claims and 2, how is this going to even happen, right? When you have the volume of patients coming in, thank goodness, thank God, right, that we do. And so, for us, it was breaking down each department, like I said, breaking down the tasks and seeing how can we get the support that we need. Is it somebody that can be in office and do it? No. Is it in kind of doing kind of like your little charts that you would do in school, right? It's like, okay, can somebody in office do it? Yeah. But should they? No, right? And so it's like, where can you look to maximize remote support for your office for 2 locations by 1 person? Well, if I don't have to have somebody physically there, I can have somebody like an insurance virtual assistant doing all of my claims, making sure that they're right, by location. And so, there's not really one answer of how you scale so quickly. It's a combination of literally everything and being crazy enough to try a million things under the sun to get to the right thing, or process, improve, trial and error, even with your virtual assistants, of what can be maximized, what can be replicatable. Because sometimes working with them, they'll give us an idea of, hey, well, have you thought of this? And you're like, oh my gosh, that actually makes so much sense. Yes. Thank you for asking for more work. And thank you for trying to help, give us the availability of in-office team members to have them at both locations, while knowing that my AR percentages are in the most fantastic place that they've ever been in since we've been open. So
That's great. It's so great to hear. In fact, what Christina's talking about, just so everybody on the webinar has a clear understanding, is buying back your time. And so the major challenge that we have in clinics, whether we have in-person staff, whether we're doing this stuff, there's things that take up countless hours of your time. And these countless hours of your time, you can't get this time back. And so if you can free up people's time to focus on growing the organization, to grow the business, the routine repetitive tasks can be handled by somebody else. Things like answering new patient inquiries. Imagine 4 hours a week of your time being freed up. Or scheduling and rescheduling patients. Now you have a full calendar with less chaos. How about insurance follow-ups, right? She's talking a lot about insurance verifications and billing. 3 hours a week, just having somebody else do that for faster treatment and better start times. How about patient or parent Q&A messaging, right? They just send you messages and somebody has to be responsive. You get 2 hours a week tied up in this. Or sending soap notes and soap reports to the dentist and the follow-up reports that have to be done. Let's say 2 hours a week you're doing this. And well, now the provider can go home on time. They don't quit on you. They stay in your organization. And if that's you, you don't quit on yourself. And then lastly, how about the last 2 hours post-consult follow-up phone calls? So that, like Christine was talking about, bringing people back in, birthday phone calls or follow-up messaging. These types of tasks and things, guys, inside of the office this was only 15 hours. By the way, this is only 15 hours worth of work, but those 15 hours are the chaos that you feel. They're the overwhelm that you feel. They're the lack of growth that your organization is getting because it's tied up and being bogged down. If you had 15, that's just 15 hours. Think if you had 15 more hours to think for yourself this week, just to sit and think so that you can actually scale the 2 practices. That's the benefit of utilizing virtual remote staff and having an organization that's able to supply and support for things that are not, I call them the money things. They're not the high value things, but they're the ROI things that drive your organization and your business forward. All right. Christina, this has been an amazing conversation. We have gone over a lot of stuff. We've talked about everything from patient satisfaction to how to utilize a virtual assistant. We talked about this funnel concept of what virtual assistants can do for your organization and what a organization who's not using virtual assistants, the areas they may be missing, slower start time, staff burnout, loss of treatment revenue that they're missing, all the way to the upside down, what we're calling the SnapScale funnel, which is a faster pipeline from inquiry. Parents feel better supported, the team members feel better support. The doctors have a better focus and they get better outcomes that they're looking for, and team morale improves. This is just in just this short hour of time that we've talked about. Imagine how much people, they just don't know what you know. You know what I'm saying? Like you've learned a lot just from hiring a virtual assistant and having them work inside your organization. If you had advice for people considering a HIPAA compliant healthcare virtual assistant from SnapScale, what advice would you give that person?
I would probably say that you're still going to need a very strong team member to be able to manage them. So just because they're an extension of you and they can help you do additional tasks, there's still a person that needs to be managed. And so I'm very thankful. We have a team member, Janelle. She's amazing. She is like an octopus. She has her hands everywhere. But she has really been instrumental in being able to be that stateside management and leader that the virtual assistants would need to be able to be successful. And so if somebody is considering virtual assistants, one, of course, you need to make sure you have all of your things pulled together to be able to support somebody doing remote work for you, right? All of our stuff is cloud-based, so that was an easy transition for things, for the most part. But it's not just that. It's that daily interaction. It's the daily refocusing, as you mentioned earlier. It's the daily, troubleshooting of things that might be happening, right? Not necessarily internet connectivity. Everybody thinks of that as an issue. That's not the issue. The issue is, that, it's a holiday in the US and phone lines are down for insurance companies. And so being able to, if somebody is considering enhancing their practice by using virtual assistants, I would say one, of course, being able to be prepared as much as possible, but also having somebody that they're going to go to that's strong, that's able to give direction while they're, working for you. It's not realistic to have the orthodontist, in any way be able to have those daily interactions and refocus the team members, process improve, make sure that things are, kind of happening the way that we need them to happen, and even retraining if needed. And so I would for sure say that that's, I think, probably one of the biggest things here for us is definitely that strong on-site stateside manager to be able to interact with them. Of course, SnapScale has their own management team and things like that, and they're handling all those back-end things. I'm talking about management of the workload and of what's happening at the actual clinic that the virtual assistant is enhancing.
Absolutely. Yeah, we call it an augmented leadership style, meaning that you're augmenting the leadership, we do the management piece. And so you still have to provide clear leadership, clear direction on what needs to be done, give feedback to your team member. They work directly for your organization. So they're not shared services. They work directly for your practice, making sure that they're following your direction and your basically your feedback. So if you don't give the feedback, the person doesn't know. And I would tell you that one of the greatest challenges that we ever have with practices, Christina, is not like your guys. Your guys' practice is fantastic. But one of the greatest challenges we ever have is just not getting any feedback at all. We try to send surveys, we try to set up meetings, we try to meet with people, whatever it is, we try to get the feedback, and there is no feedback. Nothing comes. And so appreciate the opportunity for you sharing with everybody that, just like I'm saying, and just like you said, you got to give the people the feedback so that they can accomplish the goals for your organization. Christina, if somebody wanted to connect with you, they wanted you to speak at their event, or if they were a dentist and they needed to provide you a referral, how would they get a hold of you?
Oh, they can text me. No, I'm just kidding. I'm like, maybe eventually, but no, definitely would be via email. Everybody's connected to that. I have it on my phone, looking at it morning, noon, and night. So it'd be Christina, CHRISTINA .McGinnis, MCGINNIS @ redemptionortho.com. And I will be on the other end of that.
Thank you very much for your time, for spending time with us today, and taking the opportunity to explain to people what it's really like to work through hiring, onboarding, and staffing a virtual assistant in their organization, but how you did it to scale the two organizations. Thank you.
Of course. Thank you so much, Nathan.
All right. So there you have it, guys. We talked a lot today about how to scale, what tasks somebody can take off of your plate, how to get chaos down to peace of mind. We went from understanding why you utilize virtual assistants, how to utilize virtual assistants, what to do with your virtual assistant, and what specifically to do to lead that virtual assistant. I would also tell you that if you're considering an organization for your virtual staffing, remote staffing, or how to just even add staff to the clinic in an affordable way to remove these tasks, all right, these things, these repetitive things that need to get done, like we talked about earlier, think about SnapScale, please. There's no long-term contracts with our organization. We have the Snap Assist program, which we're just now rolling out, which is coverage for common tasks that get done for business continuity purposes. We have the Snap Academy, where we're certifying our own virtual assistants. So we're providing startup training to get somebody into the industry, leading them right out of college with maybe a healthcare degree, and then certifying them to become healthcare virtual assistants so that we can provide staffing quicker and more effective to the ortho and dental, plus a lot of other clinics. But we're providing that training right out of college for them and getting them certified to do this role. We also have the SnapShield program, which is a 13-point no-nonsense HIPAA compliance program with an annual audit that's included. I'm going to share with you a message from our auditor. You guys will get to hear what he said about our audit here recently. So you get to hear all about the HIPAA compliance that we have within our organization. I'll share that with you at the very end of this program. We have staffing in our offices that are HIPAA compliant. What does that mean? That means that we actually own the business, the buildings inside the Philippines and in India. It's not somebody else's business. We're not brokering these relationships. These are actually our team members that work in our offices that work directly for your organization. All right. The HIPAA compliance certification we provide all the team members. We have the Safe Base initiative. I'll talk about that. I've talked about it on previous programs. I'll talk about it with you in future programs. We have the employee placement guarantee. This means there's no charge to find a new replacement. Okay. If you, for some reason, the virtual assistant you have doesn't end up working out, there's no cost to replace your virtual assistant. There's no additional fees beyond the hourly rate and setup. And you're provided an outsourcing staffing expert to work you through this process and help you see if you're ready for outsourcing. We also have a US-based leadership team and operations staff, which means you sign a BAA with our organization. That business associate agreement is with a US-based organization. The reason that's important to you, and the reason I put it in the slides here and why I even bring it up, is because if you work with an organization that's based out of the Philippines, the problem is the US government has no jurisdiction in the Philippines. So if they were going to go after somebody for HIPAA in the Philippines, they can't go there and take action against them. Our organization is US-based company, so the things I'm telling you about, signing the BAA with us, you know that we stand by our HIPAA compliance. Okay. We also have these other difference makers. We've been over 22 years of experience in this global staffing. We have impressive longevity of a management team that's been around, most of them for more than 4 years with our organization, which is insane in this day, in this economy, in this market. Our SnapScale manager, team lead, we have a person on the team that's focused on your account and how your EMR and how your staff member operates doing your business. To be able to back that team member up and understanding. There's also assistance with procedure documentation, recording for future references. We have that integrated or augmented leadership model that I was telling you about so that you can work directly with your staff member. They attend your company meetings and participate as part of your team. And you get a dedicated team member that works directly for your company, utilizing your systems. Plus, we didn't even talk about today the daily reporting that goes in, and you can actually see the work from every team member on what's been done for the previous day. If any of this or all of this is of interest to you, there's a really simple thing to do, and that's just schedule an appointment with an outsourcing expert here at SnapScale. It's super simple. Scan that QR code that's on the screen, and we'll get you a copy of the case study from today. We'll get you the Christina McGinnis Orthodontics Redemption Orthodontixs case study that we did, showing how she scaled to 2 operation. There's a little more detail in there about what specific tasks and different things that you might not have caught in the show today that you went over. And so that's going to be beneficial for you. So go to snapscale.com/start or scan the QR code on your screen, whether you're watching live or on replay. That QR code will take you exactly where you need to go to be able to schedule an appointment, to be able to see, are you ready for outsourcing? Is there a way that you can implement this inside your practice? Some practices are not ready. They're not the right organization, and they just don't have the right culture to be able to set this up. Some organizations do. And so, I personally believe that every organization could utilize some type of virtual support that is cost effective to remove repetitive, redundant tasks that are consuming hours and hours and hours of their time. But that's me. We have to have a conversation with our organization to make sure that that's you also, that you're ready for that you can release the reins of having somebody sit in your physical office to do the work. Maybe you like paying the additional $30,000, $40,000, $50,000 a year in order to have that staff member in your office. And that's okay. Maybe you do hire those people to do that stuff. It does inflate the cost of the patients, though. It does remove your ability to hire more staff to provide even better patient care. I think our economy and the way things are going right now, it might just be set up in the right time for you to have a conversation about virtual staffing. And if that's the case, scan the QR code or go to snapscale.com//start, and that will get you all the information that you need about it. I'm going to finish up and close out this conversation with you guys today in a very simple way. I want to share with you what our auditor said about our standard for HIPAA compliance at our organization. If you're wondering, okay, all this sounds good, but is my data safe? Is my patient's privacy protected working with a company that has staff members in the Philippines? Let me share with you. I'm gonna play this video. Please stay till the end. Watch this entire video. This is what our auditor had to say.
Mike is an interesting example. Mr. Yablonowitz and SnapScale, previously Brobisco, or BBC Global. We don't know, HIPAA training doesn't do webinars. We don't partner with clients and help them market. My purpose of being here is not for marketing. I'm not interested in generating sales from web contacts. What I am interested in is taking information that shows up regularly and becomes problematic regularly for our clients so that you're conversant and know how to ask questions and know what the answer should sound like. Mike is an obsessive when it comes to compliance. The way he approached compliance when he became our customer 3 years ago was, yeah, but how do we do better? But I know what the minimums are, but I've got some clients that are concerned about VAs, and what do we do to bolster, Matt, honestly, how do we show up as the best in the market? And it was a year, maybe a year and a half working together on a system that didn't exist. It doesn't exist anywhere. I can tell you, we have dozens of virtual assistant platforms that work through HIPAAtraining.com, and there are probably 100 more that work through other of our peers in the industry. And the reason SnapScale is the only organization that we will do this with is because they exceeded the minimum standards. Then they exceeded what were considered exceptional standards. And then they started creating their own standards that are so far and above, they're so beyond the pale that it's going to generate a new standard in what is considered remote virtual healthcare.
Thanks, guys, for attending our webinar.